Hello, and welcome to LifeBridge Health's Facebook Live series. I'm Sharon Boston. Today we're here to answer your questions about your eyes, particularly how your vision changes as you get older. If you have a question about glasses, vision testing, or other concerns, please post your question in the comment section below. And remember to hit the subscribe button so you'll be notified each time we go live. Joining us today to talk about those aging eyes is Dr. Clare Kelliher from the Krieger Eye Institute. Thank you for joining us.
Thank you, Sharon.
Well, we're all getting older, and the aging process also affects our eyes. So how often should people have their eyes examined, and why?
Well, we recommend that at least every year people have their eyes examined, especially for people who are still driving, still very active. It's amazing how things can happen slowly over time and you don't realize it. As well, people might need, just an update on their glasses. Really good idea once a year just to get the eye checked front to back.
And before we went live, we had Donna posted a comment and said, sometimes my eyes get blurry.
If it's a sometimes thing, it happens sometimes, it's not there other times. See if it's something like if you blink a few times, does it go away? And if that's the case, Donna, then it may just be a little bit of dry eye. So what I would say to you is to make sure then you just use some artificial tears. If you go into the drugstore, you're going to be able to see that there's a whole kind of, array of eye drops. And what you want is you want a plain artificial tear. Now, nothing that says get the red out or redness relief, just a plain artificial tear. And start off by putting that in regularly. A drop every couple of hours. And if you're doing something, maybe you're sitting down watching a good film, maybe you're reading a good book, or you're really interested and you're not blinking as much, pop a drop in before you start.
And what about, can people have blurry eyes like when you wake up or late at night? Can your eyes be fatigued?
Yeah, absolutely. But more often than not, again, it's a little bit of dryness. By the end of the day, the eye gets dry. A few drops of artificial tears are the way to start. And if it doesn't clear up, then that's your signal. You need to get the eyes checked out by an eye MD.
And now, we talk about getting older and reading. These people, you're holding the books farther away or the menu. So what about when you have trouble reading as you get older?
So the first thing to say is, look, it's completely normal. There's no avoiding it. You either need to get yourself a longer pair of arms. Okay, this is my joke, okay? It gets a bit old. But you need a longer pair of arms and you need to get yourself a pair of reading glasses. So you're going to start off and you're going to need a lower strength reading glass, and then as you get older, the strength that you need is going to increase. Now, there's nothing wrong with your eyes. There's nothing happening. I say to people, this is inevitable. This is like getting a few gray hairs or a few wrinkles. You don't have a choice in this. This is just what's going to happen to you as you get older. So reading glasses, good way to start. They're going to get stronger as you get older. Completely normal. There's no way around it.
And at what age do people start seeing?
Usually from around your mid-40s. Okay, I already find that my glasses, I'm nearsighted. My glasses are often tucked in my pocket. I need a little bit more help up close, so I leave the glasses off because my nearsightedness helps me cheat. So around your 40s, it's going to start happening.
And then you said that strength will increase as you get older. How long does that decline, or does it just vary by person?
Varies by person, but you can kind of guess that when somebody's in their 40s, they're going to need, you go in and there's different numbers of reading glasses.
So can you get them in the drugstore? Do you have to go to the ophthalmologist?
Yeah, it's perfectly reasonable to start in the drugstore, okay? So you start, and what I always tell people is give yourself a few minutes, bring whatever it is you normally read with you. So do you want to read a book with fine print? Do you want to read a tablet? Or, what are you going to be reading? Then sit yourself down, get yourself comfy, and hold it where you normally hold it and try on the different pairs. So if I had somebody who's in their 40s, I'd say maybe start around a +1. If I had somebody who's in their 60s, I'd say you need to be up at around a 2.5 or so. But try on the different pairs, and you may find that you need a different strength for reading and for computer, because the computer is further away. But good place to start off. If it's working for you, stick with it. But if you're having trouble, again, just get your eyes checked out properly.
And what about the computers and the tablets and the phones? Are those affecting our eyesight, or can that exacerbate the aging eye?
Again, what we find is that people are spending a long time focused at a single distance. So your computer is yay far from your eye. You're focused at that time. You tend not to be blinking as much as you should. So we do say to people, set a timer on your phone. About every 30 minutes, we want you to turn around, take a look at a different distance, give your eyes a chance to focus at a different distance. Blink a few times. It's amazing how little we blink when we're really focused on something. and just give them a break for a few minutes, even kind of close them for 30 seconds and then start all over again.
So we have a question. Someone said their eyes have become dry as they've gotten older. What treatments are available? So you mentioned a little bit like the drops from the drugstore.
You start off with the drops from the drugstore. The other option is that those drops do come in an ointment format. So if they come in an ointment format, you can try those last thing at night, just before you're going to go to bed. Get a little bit on your pinky finger, look up, create a pocket, and get that ointment right into your eye. The other thing that's actually very soothing for a lot of people is heat onto their eyelids. And the benefit of this is that right beside where your eyelashes are, there are tiny little oil glands. And those oil glands have a tendency to get blocked. So by applying heat to the eye, you melt, literally there's nothing fancy, you melt the oil and the oil comes out onto the surface of the eye where it should be. So think of it like a facial for your eyes.
Do you think like a warm washcloth or?
You can do that. It tends to get a little bit messy. So we say to people, you either buy one of those kind of fancy kind of heat 'em up packs that you can get at the drugstore, or do a DIY version. A cup of uncooked rice into a stock into the microwave, 30, 40 seconds, let it heat up and apply that to the eyes, 5 minutes twice a day. And after you've done that, get a little bit of dilute baby shampoo. Again, you just want something that won't be too irritating, and clean along where your eyelashes are. Yeah, so that's going to help too.
Good tip. Mary asks, how can I keep my eyes healthy?
Okay, so get your annual eye exam, wear your sunglasses when you're outside. And the other thing then is a really good kind of healthy diet. We know that things like age-related wear and tear are, one of the big things that we can change is having a healthier diet, lots of leafy green vegetables, and then not smoking is a big thing. And if you do have things like diabetes, blood pressure, make sure they're under control. Okay, we do still see people who lose vision, fairly regularly from diabetic eye disease. So any medical conditions that you have, keep in touch with your PCP and make sure they're well controlled.
And I've heard some people are diagnosed with other conditions based on the eye exam. What can you see?
So when we, actually I've got my little eyeball here, when we look into your eye, okay, we look right through the center, because the center of your eyeball is actually perfectly clear. The pupil is just a hole in your iris. And it allows us to look right into the back of the eye. So that's why you get dilated when you go to the eye doctors. We increase the size of the keyhole so that we can see more in here. So basically we take a look here at the back of the eye and we'll tip it up, and they kind of, they've drawn a few representative blood vessels here. But when we do an eye exam, we're actually looking at the internal blood vessels of the body. So we can see things like bleeding, leaking related to diabetes. We can see blood vessel damage related to high blood pressure. All of this is perfectly visible to us. So we can tell a lot of times if your diabetes is controlled okay, if your high blood pressure is controlled okay.
And when people have diabetes, eye screening is part of their regular
Absolutely.
care.
At least once a year, again, they really should get their eyes checked out either with an IMD, or more and more what we've been doing is using cameras to take a photo. And the photos are sent for screening to some of our experts here. If they notice a problem, the person will be called in for a formal check.
We have remind people, if you have a question, please post it in the comment section. Dominic said, is it okay to keep my eye drops in the refrigerator? The cold feels good.
Absolutely. Yeah. We sometimes recommend it for people maybe who have eye infections and things like that. It can feel very soothing, so not doing any harm.
And it's also something that some people get cataracts. What are cataracts?
So cataracts, again, that's another thing like the problem with reading. There's no way around it. So from about your 40s, there's actually a little structure here right behind the colored part of your eye, and it's called the lens. And the lens helps focus light. And when we're young, that lens is perfectly crystal clear. But as you get older, the lens turns foggy. And that's all a cataract is. It's a foggy lens. So when you're young, perfectly crystal clear. When you get older, it turns foggy. So the foggy lens will do two things. It may stop light reaching the back of the eye, then your vision decreases. Or the other thing that it may give you, and I see probably at least one person per week, is it can give you very bad glare. The light comes into the eye, hits the cataract, bounces all over the place where it shouldn't. And people get really bad glare. I regularly have people who come in and they've stopped driving at night. because the glare has gotten so bad. And this is a big deal because it really affects people's quality of life, their enjoyment of life. So I've had a lot of people where they come in, we fix their cataracts, and they're back driving at night happily.
But how do you fix the cataract?
So how do we fix it? I'm just out of the operating room. We just fixed it. So what we do actually is a small day case surgery. So people come in, go home the same day, and we do a lens replacement. We take away their old foggy lens, put in a new clear lens. It's a procedure that only takes 15-20 minutes usually. And as I say, done in a day case, done with sedation, and really is one of the miracles of modern medicine. It just, it allows people to regain their vision and just improves people's quality of life so much.
Yeah, my mom had, and said things were so much brighter in the color. She hadn't realized how much her vision had diminished.
And again, it happens slowly.
Mm-hmm.
And it's amazing as humans how if anything happens slowly, we just adapt. People get on with it. And it's still, I've been doing this a while, but it's still one of the great kicks that I get when I get an 85-year-old to come back in. And again, they just get so excited. They hadn't realized how bad it had gotten. We do their cataract surgery, and it gives them a pep in their step.
Do you do both eyes at the same time, or really you get to do one eye at a time? Or I guess it depends on how the cataract is.
Very rarely, for kind of medical reasons, usually we will do two eyes at once. Maybe if somebody needed a general anesthetic or if they had other issues going on. For the vast majority of people, safety comes first. So we do one eye, let you recover, and maybe 2-3 weeks later, when we really feel that you're doing well, we go in and do the other eye then.
And could that lens develop a cataract, or is it because it's an artificial lens it won't?
The lens itself will not develop a cataract, but we do piggyback on the natural capsule or the natural, the lens has to be suspended in a very careful position in your eye. So we actually use your original suspensory mechanism, and that capsular covering, that can get a cataract, but if it does, it's a 5-minute procedure in the office, painless laser to clear it up again.
All right, let's see, we have a question. My general ophthalmologist told me I have EBMD. Who would I call to follow up a cornea doctor?
Yes.
What is EBMD?
That's epithelial basement membrane dystrophy. And essentially what it means is just that the surface of the eye is not completely smooth. So think about it, your skin should be completely smooth. If there was a little blister here, okay, first of all, it's going to cause you discomfort as your eyelid goes up and down over the blister. And sometimes the blister can get knocked off. So it's going to be painful some of the time, and it's going to affect the quality of your vision.
Someone says, can using your cell phone or computer too much cause vision problems?
Again, it's usually more a strain kind of issue where the eyes dry out or your poor eyes have just been focusing at the same distance all day. So take regular breaks, use artificial tears as you need them.
Okay. Someone asked about if you have any suggestions about eye drops, the different eye drops to use.
No.
No.
I say to people, it's kind of like choosing a cereal. Some people like cornflakes, some people like Crispies. Try one. I always tell people start off with the one that's from your pharmacy, just a generic kind of one from your pharmacy. And if that works for you, good. If it doesn't, try out the different ones. The weakest ones are a drop. Then one step off, we've got gel drops. These tend to be slightly thicker. They last for longer, but they can blur your vision more. And then finally, there's the ointment nighttime formulations. But start with the basic one. The only thing we don't like is anything that says get the red out or redness relief. They're a no-no.
Okay, someone asked, are there any symptoms to look out for that might signify something is seriously wrong?
Again,
your vision.
And the one thing I would say is that for most people, we use two eyes all the time. And unless you're doing something like putting on eye makeup, you tend not to close one eye at a time. So it is an idea once in a while to cover each eye, see, can I see well out of each eye? Because it's amazing, again, if it creeps up on you slowly, how people may not realize that there's an issue with one eye.
And that's why saying my regular eye exams are so important.
Absolutely.
Helene asked, my cousin has diabetes. Is that dangerous for his eyes, and can he do anything to prevent problems?
Is diabetes dangerous for the eyes? Absolutely. So as I say, every year we see quite a number of patients here who have a significant loss of vision because of diabetes. So the messages are that you have to keep your diabetes well controlled. And then regular eye checkups are really important for two reasons. One is that we can look for damage within your eye. But the other is that we can kind of tell how good your control is. We can tell if we're starting to see bleeding, if we're starting to see leaking, because if we see it in your eyes, then it's happening in your brain, your kidneys, your heart, all those other very important places. So for some people, it can be a really good thing for them to know that there are changes that we're seeing. And it means then that they, it spurs them off to get better diabetic control.
And also, as we age, some people hear about glaucoma. What is glaucoma?
Yeah, glaucoma. It's another one of these things that people hear about, and it can kind of get confusing, the terminology. But glaucoma is basically damage to this nerve here at the back of the eye. So the lining of the eye is called the retina. The retina gathers together and forms a nerve at the back of the eye. Now think of your eyeball like a camera. Your eyeball just takes in the signal. To actually process that information requires your brain, actually the area back here at the back of the eye, at the back of the brain. And there has to be a cable or a link between the two. And that's what this nerve is. Glaucoma is damage to this nerve. So you could have a perfect eyeball, a perfect brain, but if the nerve gets damaged and there's no cable between the two, it can cause vision loss. The problem with glaucoma and this nerve damage is that it happens silently and slowly for the vast majority of people. So people don't realize that there is an issue until suddenly they start to develop tunnel vision. So again, another reason to go get your annual checkup, make sure that this optic nerve is working well, that the cable is still intact between your eyeball and brain.
What would cause that damage, or is there a known cause for glaucoma?
Well, in the community that we serve here, we see a lot of people with a family history.
Someone asked about family history.
Yeah, they know that mom, dad, their aunt, their uncle maybe had to take a lot of eye drops, had to go regularly to see the eye doctor. So family history is big. The second thing would be an African ancestry tends to run through African families, and it tends to be a more severe disease. So another reason to get regular checkups. You are not going to feel this, you're not going to sense it until it's too late, until you start to develop tunnel vision.
And what is the treatment? Can you slow that progression?
Absolutely. And the treatment, quite a few treatments available. Generally, we start off just using drops. For some people, then we may do a laser. And finally, in a minority of patients, surgery is necessary. But again, knowing that you have the condition is key, and it can only be diagnosed on an eye exam. It's not something you're going to realize that you have. So that's why your annual checkup is important. Something like glaucoma can develop as you age. You may not have had it 5 years ago, but you may be developing it now.
Linda asked, is it bad for your eyes to wear two different strength contact lenses at the same time, one for distance and one for reading?
Absolutely not, Linda. That's a perfectly acceptable idea. So basically the idea is that the same way we're right-handed and left-handed, we also have a dominant eye. We're either right-eyed or left-eyed. So if you talk to somebody, maybe who enjoys kind of hunting or something, they'll be able to tell you which their hunting eye is. So the stronger eye is generally the eye that we use most in the distance. And so what we do we call this monovision. And what we do is we get you to use your strong dominant eye for distance, and then maybe we undercorrect your other eye, and that does your up close. We use that in contacts, we use it in laser vision correction, and it's absolutely fine to do it.
Is there anything else you want to add? We're just about out of time, or anything else for the viewers?
No, but happy to take any more questions. Come see us.
Great. Well, that again is about all the time we have. Our thanks, Dr. Clare Kelliher from the Krieger Eye Institute. If you'd like to learn more about her and the team here at the Krieger Eye Institute, visit our website. It's lifebridgehealth.org/KriegerEye. And a note for those of you watching us here in Baltimore, coming up on Thursday, March 8th, the Krieger Eye team will be at WJZ TV Channel 13 for Ask the Expert. It's a daytime broadcast. We can call in and talk to someone like Dr. Kelliher from the Krieger Eye Institute. That's coming up on March 8th, and you can find out more on our LifeBridge Health website. I'm Sharon Boston. Thanks so much for watching LifeBridge Health's Facebook Live interview with Dr. Clare Kelliher, and we'll see you next time.
Thank you.